talk today with Vann Joines, who is presenting a workshop at Southeast Institute on working with families. Vann, will you talk a little bit about the value of working with the entire family?
Yes, I'd be glad to. I think the value of working with the entire family is you're working with the actual people that the client is dealing with. In individual therapy, often we do role plays or we do gestalt dialogues or whatever because you don't have the rest of the family there, family members or spouse or whatever. And when you're doing family therapy, you've got everybody in the room who's involved often in whatever the problem situation is. Frequently, when an individual in a family has a problem, it really impacts the entire family. And so by having the actual family system there, you can see how that's occurring, and it gives you many more options for resolving what's going on.
This workshop is titled An Integrated Approach to Working with Families. I'm wondering what your integrated approach is.
Well, there are many different approaches to family therapy, and each one of them was originally involved in working with a particular type of family. For example, Salvador Minuchin's work on structural family therapy was really designed to work with families that didn't have appropriate structure to really help people get their needs met in appropriate ways. And so it really looks at the configuration of the family and any structure that is needed that wasn't there in the beginning. Strategic family therapy was developed by Jay Haley as a way of working with power issues within the family. General family systems therapy was developed as a way to understand the behavior of any entity within the family given what was happening in the overall context. If you look at just one member's behavior, it may look very bizarre. For example, you might have a teenage son who's stealing things from stores, and it looks like he has a problem. And that's really what's going on. But if you look at what's happening in the overall family, what you may find is that the only time father takes off work to really spend any time with his son is when he gets into trouble. And not only that, mother and father have a hard time getting close or spending much time with each other. And the only time they get very close is when they're having to deal with problems with son. So everybody in the family is really gaining benefit from son having a problem of stealing. It allows son to get attention and recognition from his father. It gives father justification for spending time with his son. It gives mother and father a way to come together and get their needs met from each other that they normally don't do in other ways. So it's helpful to think about what the benevolent intent is in any symptom that's going on in a family. It gives you an opportunity as therapists to work with that to help the family really resolve the root cause and not just scapegoat one member as being the pathological entity that you're dealing with. Power issues that are going on in the family.
What is the value of this training in family therapy for therapists?
Unless a therapist has gone to a specific program to learn family therapy, most of the therapeutic approaches that are taught are for individual therapy or in some for group therapy. So I think it really is important for therapists to also have training in family systems therapy and different approaches to family therapy because it really is a different way of working. And without training, it can be very confusing and very difficult. One friend of mine who is a family therapist talked about it as trying to stir 6 boiling pots all at once on your stove. There's so much going on unless you have a way of making sense out of it and understanding the dynamics and why people are doing what they're doing, it can be very confusing. Therapists can often do more harm than good if they really don't understand what's going on.
I think that's part of the reason that a lot of therapists don't do family therapy. It can be overwhelming or seem like a lot of work. And I'm wondering how somebody moves from that position of thinking that family therapy is something they can't do to being willing to experiment with it.
Well, in addition to teaching the theory in the workshop, we also do simulated family work with members of the workshop, and people get a good sense of how you go about doing family therapy. Once you know the basic dynamics and how to go about working with the family, it really is a lot of fun, and in many ways is much more enjoyable and fun than just individual therapy. So I think through the workshop, people get sufficient training that they really can begin to work with families themselves and really experience the enjoyment of that approach.
What is one of the biggest myths that families bring to therapy?
Well, I think one of the biggest myths is that there is a person in the family who is the problem. In reality, it's the system that has been created that is really the problem. And by changing the dynamics of the system, it really helps the individuals within the family change. For example, people, going back to the example I was using earlier, a child acting out as a way to get the parents' attention and to allow the parents to have a justification for getting close to each other. So the real problem within the family is people not feeling comfortable being close. And once you solve that, then you not only stop the child's acting out because you give them a direct way of getting close and getting their needs met and not having to use indirect or substitute ways. And it also solves the other problems that are going on for other family members in terms of their discomfort in being close. So it really gets away from the idea that the problem is being caused by one individual in the family.